CPR Debriefing by Mynhae Dae.
What is CPR debriefing? About 350,000 people experience cardiac arrests each year requiring CPR, with half of them occurring in the hospital. CPR is so important, and that is also why it is very important to debrief. CPR debriefing is when healthcare workers involved in the resuscitation gather after the event. This can include the doctor, the provider, respiratory therapists, nursing staff, and the charge nurse. Everyone gathers to talk about what went well and make sure everyone had clear roles and what can be improved for next time. What are the benefits of CPR debriefing? Studies showed improvement of CPR quality of a study group where CPR debriefing was implemented. The knowledge of CPR of each participant was measured using a statistical test value before the implementation and after 3 sessions of debriefing. After the implementation of CPR debriefing, the participants' knowledge and performance of CPR score has more than doubled than what it was pre-implementation. This seems like a significant improvement with clinical data to show the importance of debriefing of CPR, not only for improvement of knowledge, but also improvement of performance in the future CPRs so that more of the patients' lives can be saved. There are also 4 different approaches of debriefing. Psychological debriefing, which helps to prevent or reduce the symptoms of traumatic stress of the healthcare workers involved and also help normalize their recovery. Second, psychological first aid helps the healthcare team members provide pragmatic social support for each other. Third, debriefing for simulation-based education promotes the learning by the healthcare team members. Fourth, quality improvement approaches and the after-action reviews help focus on the system of improvement. This is a great approach to help the healthcare professions recover in a healthy manner after CPR event because some can be very traumatic. Also helps focus on social support by everyone involved, talking about ways to promote learning from the event. Some other benefits of CPR debriefing includes enhancing nursing and collaborative practice. Clinical debriefing can be described as the 5 E's: educated, experienced facilitator, environment, education, evaluation, and emotions. This helps create a better collaboration among nurses, but also very advantageous to positively impact healthcare teams, patients, and organization. It's recognized that clinical debriefing promotes uniformity. There are 3 main types of debriefing: hot, warm, and cold. Hot debriefing is when the debriefing happens immediately after the CPR. The pros of this type of debriefing is that it is great for addressing urgent issues immediately, recall bias being minimized, and more emotionally motivated to participate. Some of the cons of this type of debriefing can include being limited in time due to the extensive time spent in the CPR, having other patients' care priorities, and not being emotionally ready. Warm debriefing happens hours after the event. The benefits of this type of debriefing can be that it gives time to complete post-code tasks, gives staff time to plan for debrief, staff will be more emotionally ready, and quantitative data is available. The disadvantages would be decreased participation due to team being scattered and loss of enthusiasm to participate. Cold debriefing is when it happens days to weeks after the CPR event has already occurred. Pros would be that there is a longer length of time for deeper discussion, allow emotions to settle, present quantitative data, and have follow-up on patients' outcome after the event. Some cons would be that all the staff that participated that day will be harder to gather, memory might not be as fresh, and time and resources needed to set up location and time. Some of the debriefing questions that was given to my unit included, did everyone have a defined role? Was there clear communication with closed loop communication? What went well during the event? What went poorly during the event? Was ACLS protocol followed? Did all of the equipment work properly? Any safety or personnel concerns? And things that can be improved for next time. Implementation results. Handouts were given to 20 nurses. The debriefing questions were implemented for one event. 5 nurses were able to participate. Outcome was very positive. And 5 out of the 5 nurses that participated in debriefing after CPR voted that they would like to do it after every CPR event. And here are the references. Thank you.